Welcome to today's podcast where we will be discussing antiphospholipid syndrome, an autoimmune disease that predominantly affects young women. We will be exploring the causes, symptoms, and diagnosis of this condition. Antiphospholipid syndrome occurs when the immune system produces abnormal proteins called antiphospholipid autoantibodies, which cause improper blood flow leading to dangerous clotting in arteries and veins, miscarriage, and problems for a developing fetus. Although the exact causes of antiphospholipid syndrome are not yet known, it is believed to have a genetic component that makes some people more susceptible to the disease. Environmental factors such as infections or other autoimmune diseases that interact with a person's genetic background frequently cause the production of autoantibodies. The symptoms of antiphospholipid syndrome can vary depending on the site of the clot. The most common symptoms include clotting in the arteries and veins, frequent miscarriages, and preeclampsia in pregnant women. Clots in the heart can cause heart valve thickening or damage, with the risk of releasing clots into the bloodstream, while blood clots in the brain can result in strokes. Clots forming in the veins most frequently occur in the lower legs and can lead to pulmonary embolism, which blocks blood flow to the lung and decreases the amount of oxygen in the blood. In a few cases, repeated thrombotic events may take place in a short time, leading to the progressive damage of several organs, a condition known as catastrophic antiphospholipid syndrome. Antiphospholipid syndrome is diagnosed by testing the blood of patients with blood clots and or recurrent miscarriages for the presence of antiphospholipid autoantibodies. Screening is done using three kinds of tests because the antiphospholipid antibodies can differ from patient to patient and each single test cannot detect all of the possible autoantibodies. At least one of these tests must prove positive and be confirmed on two occasions no less than 3 months apart. Generally, the higher the level of the test and the greater the number of positive tests increases the risk of developing symptoms. However, having positive blood tests alone in the absence of a clot does not make a diagnosis of antiphospholipid syndrome. Early diagnosis and treatment of antiphospholipid syndrome can improve the prognosis and prevent severe complications. Treatment may include blood thinners, immunosuppressive therapy, and other medications to manage the symptoms. Additionally, people with antiphospholipid syndrome are advised to make lifestyle changes, such as quitting smoking and maintaining a healthy weight to minimize the risk of developing blood clots. In conclusion, antiphospholipid syndrome is a severe autoimmune disease that predominantly affects young women. While the exact causes of antiphospholipid syndrome are not yet known, it is believed to have a genetic component that makes some people more susceptible to the disease. Its diagnosis is made by testing the blood of patients for the presence of antiphospholipid autoantibodies. Early diagnosis and treatment of antiphospholipid syndrome can improve the prognosis and prevent severe complications.